Ready?
Go ahead.
Okay. Thanks, Jordan. Hi, everybody. If you're just joining us and wondering what's happening, this is our pre-meeting program, and you are at um, our January 1st pre-program meeting of 2026. Welcome. I am just very excited and happy to present a really special program for today that's going to be about healthcare, about universal healthcare, and the viability of everyone having equal access to healthcare. So I'd like to introduce our very special guests. um, Taylor is a researcher at the University of Washington studying immunology. She got involved in West Seattle Indivisible on the healthcare team because she felt there was a real need to advocate for access to healthcare as federal cuts in every aspect of public health are under threat, just in every aspect. So Taylor is feeling very strongly and passionate about wanting to do so much better and helping out to find ways that that can happen, making life better health wise for our residents, and the knowledge that everyone deserves hassle-free health care. Our other special guest presenter today is Pari. Pari is a self-employed architect in West Seattle who is tired of the healthcare rat race and feels like now is the time for Washington State to lead in solving this crisis. Uh, Pari has experienced nearly every type of health insurance option, i.e., uninsured, excellent health employers plan, private insurance before the ACA, ACA insurance plans, and universal health care plans while living in 4 different countries. Um, Pari believes absolutely that we must have universal health care in the US and that it can start here with us. And I assume that means in Washington. So without further ado, please, everyone, let's give a warm 34th LD Dems welcome with hands and whistles or whatever you want to for Taylor and Pari. Go ahead, friends, take it away.
All right, thank you so much for the introduction. Let's see if I can share my screen with you all. Haven't done this in a while. All good?
Yep.
All right. So as everyone I'm sure in this Zoom room knows, federal cuts are a real problem for access to healthcare across the nation, not just in Washington, but everywhere. But it also gives us, we think, a real opportunity for Washington to lead the nation and to provide our residents with universal healthcare. So I would invite everyone to take a moment and imagine a world in which we never have to worry about healthcare coverage, never have to worry about losing our job for fear of also losing our healthcare, never having medication or procedures delayed or denied due to insurance not covering it. And imagine that the system is actually cheaper for taxpayers in the current system, that this system is easier to navigate. You don't have to deal with insurance companies, worried about explanation of benefits not making sense, et cetera. And I want to emphasize this could be a real reality for Washington residents, and that the uncertainty of healthcare coverage in America is a policy choice, not a foregone conclusion. This can be done if there's a will to do it. And so the BBB passed last year, as many of you know, and which is absolutely gutting the ACA. Those have already expired here in Washington. And this was a projection done after the BBB was passed, basically saying that 17% of Medicaid funding will be cut from Washington State, the largest in the nation. And 26% of Medicaid users, so 1 in 4 people, will lose coverage, also the largest in the nation. Overall, this leads to almost 500,000 people losing Medicaid coverage, and this is Apple Health in Washington State. And another 150,000 people will be priced out of the ACA plans due to expiring subsidies and absolutely skyrocketing premiums. I'm not sure how many of you guys know this, but Washington is actually leading the nation in healthcare coverage. And this will basically erase 12 years of work that Washington has done to improve healthcare. What this looks like as far as numbers go and why this is really the time we need to act on this is because the statewide averages for Medicaid in Washington was about $400. For 2026, this is now $1,500. So this is a total annual increase of almost $13,000 that people will pay for healthcare. It's just insane. And so it's no mystery why I think I saw a figure today actually saying that this time compared to last year, there were 1.1 million fewer people on the ACA. And so for statewide, this is just Medicaid. We pay $21 billion, and federally, 13 billion of that is covered. So in just Washington, we'll lose about $3 billion annually, which will essentially over 10 years be 30 to 50 billion dollars in Medicaid subsidies just gone. Um, and so I really want to invite everyone to really think that as the threat of losing healthcare coverage looms, we really need to act and imagine a different policy choice. Um, and so with that, I want to play a video for you guys that the about what the different policy choice can be, namely the Washington Health Trust. And this is a video put together by our friends at the Whole Washington, who have been a real key player in getting this legislation where it is today.
Welcome to Whole Washington and the Washington Health Trust. First, what is Whole Washington? Whole Washington is a 501c4 political nonprofit. We're the authors of the Washington Health Trust. You have the only universal healthcare bill in the legislature. We are the largest universal healthcare group in Washington. Who are Whole Washington? Whole Washington is made up of nurses, activists, and ordinary citizens. We're from all over Washington state. We want to engage you in this movement. Why do we need universal healthcare? First, healthcare spending has gone up exponentially since the 1970s. Our lifespan has underperformed every comparable country. The cost of administration for private insurance is significantly higher than that of Medicare. And the United States spends significantly more compared to every comparable country on healthcare. What is the Washington Health Trust? It's a trust or fund with its own revenue stream. The fund would then pay all medical bills for Washington state residents. The Washington Health Trust can come about in two ways: passage through the Washington state legislature or an initiative campaign. Who will it apply to? All Washington state residents, including citizens and non-citizens, the employed and the unemployed, those who are sick and those who are healthy, old and the young, those with Medicare, Medicaid, and Apple Health. There are no exceptions. This is for everyone. What will the coverage be? The Washington Health Trust will have comprehensive coverage: medical, dental, vision, hearing, mental health, reproductive care. There will be no deductibles, no copays, no networks, no denials, no bills, zero out-of-pocket spending. How does the Washington Health Trust fit into our current healthcare system? You're going to go to the doctor will bill the Washington Health Trust, the Washington Health Trust will pay that bill. The Washington Health Trust will replace or supplement private health insurance. People who want private insurance will still be able to have it. Medical billing will disappear. Doctors will stay private. Everyone can keep their doctor. What will the Washington Health Trust cost families? Costs to families will be 0 to 2% of gross wages for all employed adult members of the family. Prescription drugs are included. The unemployed, children, or those making less than 300% of the federal poverty level will pay nothing. How will the Washington Health Trust be funded? Washington Health Trust will mostly be funded by employers, small businesses paying less than larger ones. Capital gains in excess of $200,000 would also be taxed. This excludes real estate, funds used to purchase a home, and retirement accounts. And this is very small business friendly. Lastly, how can you get involved? You can pledge to sign our initiative. You can sign up to volunteer. You can donate to our cause. You can print our literature. Lastly, you can attend an orientation or a town hall to learn more about the organization. I hope to see you there.
Great, so that went over very quickly. And so for the next little bit, I'll pass it over to Pari to go in a little bit more slowly through the details. But we just wanted to give you all an overview of what the Washington Health Trust is. And some of you might be thinking it might sound too good to be true, but I thought so too a year ago until I looked into it, and it's not too good to be true. It can be really that easy.
Well, I don't know if I would start with easy. but it's feasible and it's possible. Um, uh, as when was presented at record speed in that video, it's truly a public option. It's not a for-profit private insurance option. So it would be essentially a pot of money that is administered by the state, the Washington Health Trust. And it would provide comprehensive coverage. And I like the idea that there is not this point of service, there's not in-network, out-of-network, there's not copays. It truly makes it a more seamless experience without having the insurance sort of getting in the middle of it. It's interesting to me because it's already a legislation that is in the House and the Senate at the state, and it's gone through quite a bit of vetting. People have been trying to work on this for about 10 years. So a lot of really smart people have been perfecting it. And so there's a little bit of a ramp up, but if we were able to pass it this session, it could be passed in 2 years, and first enrollment could start in 2028. So that's pretty exciting. You can see there, it was filed by Senator Hasakawa and then also Reps Parsley and Scott, and it's co-sponsored by 11 senators and 12 representatives. 17. And the crazy thing is that it actually costs less than our current system once it's implemented. The big hurdle is that there's that 2 years where it's not, we have to pay to ramp it up, which is why it's not proceeding as quickly as we'd hope. You can see here that it's projected to be a total reduction in healthcare spending. I'm not going to dwell too much on the numbers just because since the BBB was signed, all of these numbers have changed significantly. So we're waiting for all of that analysis. So the question of how do we pay for it? And this is really interesting to me as a small business owner. Essentially employers will contribute between 4.5% and 10.5% of their wages, their payroll tax. And it's smaller for the small businesses and larger for the large businesses. And then for the sole proprietors like myself, it would be 2% of earnings. And so, and then the net, the long-term capital gains tax sort of makes up the difference. And, as I mentioned, the bill has that 2-year implementation period where any of that financing piece can be massaged. So there may be a little massaging needed because of the current change in federal funding available. So people have asked, what does this really mean? Right now, it's estimated that employers pay an average of $19,000 a year per employee. And so with the Washington Health Trust, it would be around $15,000. And then individuals could pay up to 2% of that. So Whole Washington actually has a really helpful cost calculating tool on their website. And I went and tried all these different ways to say, what if I were a big business? What if I were a small business? I couldn't find any way that any individual would be paying more than $3,000 a year in premium costs or costs. So that's quite a bit less than what I'm paying and probably many of you.
Certainly now with the subsidies expired.
Yes.
And so this is more detail about the transition plan. But essentially on day one, all Washington residents and employers are eligible for the Washington Health Trust and may choose to enroll voluntarily. Self-funded employer plans may be maintained and enrollment is voluntary until the waivers are acquired from the federal government. All public subsidies for plans in the exchange are consolidated within 4 years of passage. So again, just more nuts and bolts things here. And it can be covered by other health services. So some of the criticisms that have come out for this bill, in my opinion, don't hold a lot of water. Most of them are financial. Again, the upfront cost, essentially, as everyone here probably knows, Washington is in a bit of a budget crisis right now. And I know there's legislation right now in this session to champion some more progressive tax codes, but without that being the case, we are in a budget crisis. And as Puri said, there will have to be some initial investment in order to get this to work. But it is an investment because we will save the state money eventually. I'm not sure. They're still working on the financial analysis on that. And so, again, that's one of the criticisms is we're not sure exactly when this will start saving the state money. I would imagine fairly soon. And of course, this is also unpopular with insurance companies and other entities with vested interest in maintaining the status quo. And I just want to emphasize profiting off of sick people. And so this is partly why, to me, the criticisms don't hold water, because this is something that needs to happen. People are going to lose their health care and they're going to stay sick. And even sick people who need health care coverage can't get it, or it's too expensive and they have to choose. And so Puri will talk a little bit more about the two ways that this can be passed. And she actually went to the first lobby day, the first session of the legislative session on Monday, and knows all about this.
Right. Sorry, I'm an old fart and I couldn't find my unmute button. I want to tell you, just describe in a little bit more detail how the two prongs of potential implementation would happen. So the reason I was there on Monday was working on that legislative strategy. And so if we could convince the legislature to support this and vote for it and pass it, then we could start with the Washington Health Trust in 2028, which would be great. Right now, the legislation was introduced in 2025, last session, and it's stalled in both the Senate and the House, healthcare related committees. And neither of those committees have given it a hearing. So we're really trying to get them to give it a hearing so that it can be voted on and then potentially, hopefully, approved and passed out of committee. It's a little bit of a heavy lift because this is a short session, as you all are probably aware. And so, it would need to go out of the healthcare committee and then into the appropriations or the Ways and Means, the finance committee, and then pass through that and then get to the rules committee and then be released to the floor. So that's a lot of steps in between now and me getting the insurance I'm dreaming of. But we're still going to push. We have been making smaller incremental steps. There's a very positive resolution that was passed in the last session saying, yes, we want to be working towards the universal health care for Washington State. The other option is the ballot initiative. And this is where we take the power into our own hands. And this is something else that Whole Washington has been working on. And if this is the path that we need to take, the goal would be to get it on the ballot in 2028. And so past initiatives haven't been able to get enough signatures. And so the current push is to try and collect pledges so we can know who will sign in the future. Speaking of smaller bills, there are some new healthcare related bills that were introduced that, because they're smaller, they have a little bit more chance of actually being passed outright this session. I can just tell you about them briefly. The SB 5955 would deprivatize Medicaid, so take out the private insurance companies from that. SB 5948 would set some firm deadlines for the Universal Healthcare Commission. The Universal Healthcare Commission was created to champion this sort of conversion to universal healthcare. But it's a big job, and giving them some goalposts would be great. SB 5946 would expand the income eligibility for Medicaid, AppleCare, from 138% of the poverty level to 300%. So getting a lot more people coverage. The joint resolution 8206 would be protecting affordable health care for Washington residents. This is just making that a constitutional amendment. And then the SB 5947 would establish the Washington Health Board. And this is a little bit wonky in that it's kind of tied to working around some of the federal restrictions on states controlling their own healthcare systems. And as we mentioned, and you probably all know, the legislation session just started, and we want to connect with our legislators. And many of you may have done this, but we did this in the meeting this Sunday at West Seattle Indivisible. So if you would like, you can very quickly and easily send a comment in support of the Washington Health Trust. So there's both a House Bill 1445 and the Senate Bill 5233. So you can capture these QR codes on the screen. I can also put the links into the chat. But as you can see, it's pretty quick. You just verify that you are in the 34th district. Just give them your contact info. You choose support. You can choose to leave a brief message, convince them you're not a robot, and then send it. And then we don't need to spend a lot of time on sample text since you're not being forced to do it on your phone right now unless you want to. But we had some samples for the meeting just to give people some inspiration about what they could say to the representatives and senators.
All of that is just to emphasize how easy it is to show your support for a bill. You can do that for any one of the bills that Puri went over, to try to let your representatives know, or the people who are looking at the bills, that this has broad public support. And so if anyone else in the meeting would also like to get more involved in this, at the end of the video, it also says you can go to Whole Washington and, donate, volunteer, etc. What West Seattle Indivisible also has, we have our own little healthcare team, as Puri and I are part of that. And the Sign to Pledge, the ballot initiative. It is probably going to be really hard to get it out of this legislative session unless there's a really, really hard push. But there is the ballot initiative. And so this is another QR code that everyone can use to, this takes less than a minute to just put your name on the pledge to sign when there is a ballot initiative. And so just to summarize this, there are a lot of ways that people can help. One of which is to, again, contact your legislators, contact the governor's office to show your support for this. They have some sway in this, but also they have a really big microphone that they can, talk to, tweet, whatever, threads, etc., to tell people that they support this. And so if the governor's office is going out in support for universal health care, that says a lot to other people to be like, oh, wait, Washington can do this. Let's do this. Especially with the establishment of the West Coast Health Alliance, there's been a lot more imaginative structuring of how we deal with healthcare on a state level. And so I think that if we're in this moment right now where we're sort of divesting from federal aid, mostly because it's not there. But we have to imagine another version of what this can be. And so now's the time to try to act on this. There will also be upcoming rallies in Olympia throughout the legislative session that we'll work with Whole Washington on. Like I said, on Monday, we were able to go down there, and Puri was actually able to meet with Representative Alvarado, which is great. She co-signed the bill, and so had a lot of support for that, or enthusiasm for this. Pledge to sign. And honestly, one of the other things that every single one of you guys can do is talk to your friends, neighbors, and family in other parts of Washington as well. I'm surprised, honestly, myself, that there hasn't been a lot of talk about this bill, especially because of how long it's been in the state legislature and how long Washington has talked about it. I think it's just sort of been in the back burner. There are so many other things that people worry about, right? More um, smaller, easier things to do, I guess, than passing universal health care. But we're at a point right now where so many people basically don't have health care that this is what's going to work for them. And I think it's what is going to work for Washington. Um, and so one of the other things that West Seattle Indivisible is doing is trying to get stories from people who've been affected by these cuts. And so this is a QR code for our healthcare impact survey. So if you've been affected by the cuts or know somebody who's had their premiums triple or quadruple or something, and are willing to share your story, we would love to hear from you. Our goal would be to put this out in an op-ed to try to spread the word more about the need for universal healthcare in Washington. And I think that's all we have. So we can, Pri, did you want to say something else? Go for it.
I was just going to say that after talking with Rachel and Jordan, I don't think it was this past meeting, but the one before, they mentioned that the 34th Democrats, you guys have already passed a resolution to support this, the Washington Health Trust. So you have obviously some familiarity, probably a lot of familiarity, but maybe you can tell us about that and then open up the floor for questions, or you may have, you guys are so politically savvy, you may have some information that we would like to know.
Do we want to go did you have any other information that you wanted to share or anything you wanted to talk about further, or are you ready to go into Q&A? Because I am sure folks might have questions or something they want to include or contribute to the conversation.
That was all we had, so we can open it up to Q&A. Love to hear from other people.
Great. Let's
Definitely.
do that. So folks in the chat, if you want to raise your hand with a question, we can just call on folks whose hands are up, and we can just have you ask questions. Looking for any questions.
Well, and I saw in the chat, Angie, who's also part of our healthcare team, has put in some information there just about how this same process that we were just describing for how to comment on the Washington Health Trust, you can use for any bill. And it's super easy and straightforward. And really, I'm surprised at how few people know about it.
Yeah, for sure. Are you talking about the one where you can put support or yes, there are links to that, and perhaps it's worth I don't know if anyone like Jordan or if anyone has there is you're talking about there's a general link, and if you just put in the number of the bill, it'll take you right to that.
Right.
Is that yeah.
Yep.
I don't know what that link is, but I'm if I would love to have it, and I'm guessing some other folks.
It looks like Angie might have put it in the chat as ledge.wa.gov.
Well, here's
Go to the
this goes to the searching of all of the bills and initiatives,
right.
and then you could put in the number, and you can actually search by your senator and representative. You can search by themes, because once they're read in, then they'll be assigned to a committee. So essentially, the committee.
Yeah.
It is. I will attest. It is extremely easy to go to that link, and sometimes they will actually, depending on whatever bill it is, that if somebody's doing advocacy work for it, they will have the exact link, and when you click the link, it'll take you exactly to that, and you just click approve or support or pro, whatever the thing that it is, and that's it. It's very, very easy, and it's such a fantastic way to get involved and start to show support for specific bills that or if you're against something, that you can make your voice be heard. It is a really easy way to become an important representative of the 34th district. So I've got a question here for you if you're ready. Melvin, this is your question. Does this healthcare have no deductibles and no co-pays? And I do think that that speaks to a lot of people's, I don't know what to say, of disbelief, or that it really is just hard to understand that is such a, it does that, is it real?
Yeah, it is. Yeah. And there are no deductibles and no copays. There are no point of service fees. So if you go to the doctor, you go to the doctor, no copays, and the Washington Health Trust will pay for it.
And this is where the funds are going to be coming from, the revenue stream will be coming from businesses, or
Primarily from businesses. So essentially a tax on their payroll, right? So, and it's between 4.5% to 10.5% for most businesses, and then 2% for, sole proprietors like myself.
So,
yeah.
So my question is on the piggybacking on that idea. Has Whole Washington been talking to the business community, businesses sort of large and small, different sizes of businesses, and finding out what the pulse is in the business community about their interest and willingness to support it this way?
Yeah. So another question from Melvin, just want to answer really quick. Drug costs are also covered, totally covered.
I would say generic. There may
Yes.
be some small fees for some of the specialty, proprietary drugs.
Yep.
And there are no generic versions of a drug. It would just be the brand name drug. Okay.
Yes.
Okay.
And the next question I can answer really quick. Yes, this covers everyone, even if you're on Medicare. You can be covered by the Washington Health Trust if you're a resident of Washington State.
And if you're happy with your Medicare coverage, it can be used as a Medigap to pay any sort of things that fall through the cracks with Medicare.
Yep. And for your question, Rachel, about businesses, Washington has done a really phenomenal job of gathering stakeholder support. And so if you go to their website, Pri, I don't know if you have the link really easily, they have a whole list of unions that have signed on, businesses that have signed on, organizations like physician organizations that have signed on and have all supported this. I think they're still working on getting more there because there is some pushback from especially some of the really bigger companies because this is a payroll tax. I think that places like Google and Amazon might not want this, even though I think that it would either be a wash or possibly they'd save money. I talked to Jen Nye, who's the volunteer organizer for Whole Washington yesterday, and asked her about, how much businesses would actually pay and if any businesses would pay more. And she said that it would be really a sort of a fringe example or a sort of an edge case if businesses would pay more under this bill than they would in the current system.
All right, we've got some now. I think we've got the questions are coming now.
Great.
So David asks, what about federal Medicaid funds? Is this going to replace that? I am just guessing, David. You may feel free to jump in if I'm not covering what your question is about. Would it replace federal Medicare funding, or would it supplement federal Medicare funds? That's an interesting question, because if that is what you depend on, a patient depends on that. How would that affect working in the Washington state plan and the federal plan?
Right.
Yes.
That's a really good question. And I think the goal is to still continue to receive that federal money, but be able to eventually, after the full transition, to incorporate that seamlessly into the Washington Health Trust.
Yeah, sorry, I'm trying to find the slide that has it. But as Pri said, it can also be used with Medigap, so it can cover some of the things that are not going to be covered, that fall through the cracks from that. That's right, Pri?
Yeah. I mean, I think there's some difference between, Medicaid and Medicare and how they intend to apply that. But the
Mhm.
goal and part of the the difficulties in implementing a state-based plan is figuring out how to work with the federal plans and the ERISA rules and all of that. So it's
Mhm.
it's not necessarily easy, but it is something that they've really thought about, and they've come up with a proposed path to transition to that.
We've got another question here. Steve asks, how would the whole Washington plan work with larger medical systems, or like what do they call those, HMOs, or so, I don't know if that's literally, but like Kaiser,
Mhm.
which has a whole network. It's a whole network system. Um, how would the Washington Health Trust work with that?
Yeah, so it essentially, people can keep their private insurance if that's what they want. But if you're on Whole Washington, if you're covered by the Washington Health Trust, excuse me, then this uh, your doctor's office bills the Washington Health Trust, and then they pay it. So it works alongside these bigger companies. If people still have private insurance, that works just fine. It's a single payer system, so it's a direct billing to Washington Health Trust. And so you don't have any explanation of benefits, things from insurance, from like a company like Kaiser Permanente or anything. There's also no networks. So if you want to see one doctor and that you couldn't see because you had Kaiser before, you can now see that doctor, and the Washington Health Trust will pay it.
Mm-hmm. Okay, Steve, hopefully that answered your question. Here's something Dave says. If you're, and he very much, Dave is very much appreciative and admiring of the vision of the Washington Health Trust. Question is, if your numbers still haven't been updated to reflect the BBB, how is there any hope of passing this in the near future? Um, and then a follow up, why not focus on covering people who currently lack coverage instead of trying to replicate Medicare and private insurers? It seems like covering the uncovered or uninsured should be the priority. What is the response there to that?
Well, I can't speak to what all of these people in the Universal Healthcare Commission and all of their technical experts are doing, but I imagine that they're furiously working on updating the numbers because it did throw us all a little bit of a curveball. Um, and I think I touched on this, but it is unlikely to pass in this session. It's not impossible. If we had a big groundswell of public support, then certainly, it's possible. Um, but a lot of what we're imagining is that the work that we're doing right now is educating all of the people we know, educating the legislators, getting feedback from the legislators about what they need to see in order to feel comfortable with passing it. So there's still, some of that work to be done this session, even if we don't manage to get it passed this session. And I think there are a lot of other smaller bills, like the one I pointed out, that are really focused on trying to patch the holes in the dam and provide coverage for people who are lacking coverage or underinsured, can't afford the ACA plan, whatever it is. It's a tough situation because the state also is in a budget crisis where we have a shortage. And, I think there are a lot of legislators who see that, and they are working on the bits and pieces. But I think we don't want to lose sight of the larger vision, because that's really going to solve a lot of these problems. it's hard to see it because we haven't experienced it in this country. So we have such this institutional memory. You know, as I mentioned, I've lived in 4 different countries with some sort of universal health care, and they were all different. None of them were perfect, but they were all better than what we have right now.
Yeah, absolutely. Just to echo Puri, I mean, I agree that the situation we're in, generally speaking, is really bad. And even people with insurance aren't getting the coverage they need. Um, and more people are obviously going to lose coverage, can't pay for it, et cetera. But yeah, I think that it is a necessity that we make this better. And one of my hopes is that if Washington can, because we're so close to getting this to work, actually, in Washington, we are actually quite close to this. um, that if we're able to pass this instead of plugging the holes in the dam, like the metaphor that Pre's using, you don't have to worry about that. Everyone will be covered. We don't have to worry about the whims of the federal government. We can make our own destiny, to be a little bit cliche here. Um, but I guess that's my hope is that we can imagine something better. I feel like so much of what we're doing right now, and maybe this is more of a editorial of what we're doing, what the situation we are now in is we're trying to grasp on the things that we have. But I think we really need to imagine what we can do differently that will be helpful for so many people. Um, and so I think that this is probably one of the ways that we can do that. And I'm hopeful that if we get it in Washington, other states will follow. A similar situation happened in Canada with their universal health care. It just happened with one province first. Saskatchewan passed their universal health care for that province. And then every other province looked over and was like, oh, wait, they have universal health care. Let's do this. Let's do it ourselves. And now, of course, Canada has a really, pretty decent, again, not perfect single payer system. Certainly better than the current system that the US has. And so, yeah, I think the legislature is trying to fill some of those holes with those smaller bills. But I don't think we can totally fill the gap that the federal government has made with the BBB. So we need to do something different.
And I just wanted to add in and reiterate a perspective that is not hyperbole, and that is, as you said, Taylor, earlier, the US is the only, and I am not exaggerating, the only industrialized nation that does not have universal health care. And our country, our folks pay more for health care in this country than any other industrialized nation. And there, there is something very, to me, just twisted about that. It is really crazy that that is the case. And I mean, that is something that just keeps me wondering what else is out there that we can do that's better than what we've got going right now. I've got another question here for you, from Melvin again. Would all doctors be required to accept people on this system?
Yes, I believe you wouldn't be able to be turned away if you had the Washington Health Trust cover you. If
And
you're a licensed doctor in Washington, I believe you'd have to take that. Yeah. That seems right to you, Puri?
yeah.
So I think also there would be so many people on it that you would start to really limit your patient pool if you didn't accept patients on the Washington Health Trust.
Yeah. And I have a piggyback follow up to that question, which is, um, how would the billing process go? Because I just know some people who are doctors, and that is a big thing for doctors in the current system as it is, as far as billing and how that works. How would that be different with the Washington Health Trust? Because you're saying that they would bill for the procedures that they do or the services that they give, bill the WHT. How would that go with the health trust, and how different would that be, and what might that look like?
Yeah, so how it works now essentially is you go to the doctor, and they bill you for things, and you get an explanation of benefits, breaking down what the cost is, what your insurance will cover, and then what you have to pay for that. Sometimes there's pre-approvals required that may or may not be fulfilled or covered by the insurance. And so whether it's a non-generic drug or a generic drug or whatever, they might not pay, they might not, cover it. Or if it's a procedure they don't think you need because of this, et cetera, they have the say in what they'll cover and what will be approved, right? In this case, that cuts all of that out. The doctors bill the Washington Health Trust, and the Washington Health Trust pays it. That's it.
Would
Um,
the, would
And
would
I would add that I think it's similar to how the doctors would negotiate with different insurance companies, how, they work together with a panel set up by the state to determine a fair price for different procedures so that
yep.
there's a lot more transparency. Because I don't know, I could tell you some stories, and I'm sure you all have them too, of when you go in for a procedure and you don't really even know what it's going to cost because no one can tell you. So I'm excited for being able to have one entity that figures all that out and makes it transparent.
Yep. And there'll be a Washington Health Trust board, which will be one of the entities negotiating these prices and making sure they're fair. And they won't be much different, or if at all, than what is what the charges are for current procedures. I'm not sure exactly how that part will work in real life, though, because that is sort of a situation that we haven't had in the US before, right? Like a single payer system hasn't existed before. So some of it will have to be figured out in that transition period. But that's my understanding as it is for right now. Yeah.
Okay. Other questions? Anybody have things that they want to ask about or that they're wondering? And this is where, again, if you're saying, "Gosh, this sounds so good," but this is the place to bring up all the bring
Bring
up
it.
all the things you're wondering about or that you think is that could this work and what about this and what about okay, here we go.
Mhm.
Here we go. Thanks everybody. So Anne is wondering, what about elective medical care like fertility treatments? Are they covered?
Yes. As far as I understand, things like fertility treatments, gender affirming care, um, and some of these other things that might not be covered by some insurance plans now are covered.
Great. And another question. Here we go. One of the problems, and this is from Melvin, one of the problems with Medicare is that the more medical procedures that a doctor requests for some patients, the more profit they make. This system would probably have the same problem. Wondering, salaried doctors, it might be a way to sort of stop that over proceduring. I have actually also seen I had a situation. I had a dog bite, and I went to a place and they stitched me up, and that's not what you're supposed to do for a dog bite, but they did it, and I thought, oh, maybe they just did it to get the money.
Mhm.
And is that going to be
Yeah.
how would that be dealt with in this kind of thing?
Yeah. So, I mean,
Proceduring.
yeah. So I also asked, somebody asked me this question on Sunday, and I reached out to Jen Nye about this as well. And she pointed out that some of this overprescribing or essentially fraud in this system is actually easier to track when you have a single payer system because there are the Washington Health Trust Board, and if they can be monitored more easily. The other thing is that if somebody receives care that they feel like is not it's overprescribed or et cetera, that because this is a state-run program, you actually have a lot more leverage to um, uh, basically like cite them for over prescribing something. And so there's more direct oversight on that. So if it's an insurance company that you think should be doing something that they're not, it's sort of a beast that you can't battle yourself, right? But because this is a state-run system, you as a constituent on the Washington Health Trust have a lot more power to speak out and say that something you think you have been wronged, essentially, was my understanding. So, yeah.
Great. These are great questions, everybody. We've got a few more minutes. Keep them coming. Patrick is wondering, other than closing the gap, like the Medigap or Medicare, I guess these Medicare Part Bs and all those other things, um, paying for vision and dental, how does this differ from how Medicare works right now?
I mean, I think that Medicare is the closest to, universal health care that we have a common conception of. So, it's similar in concept, except it would apply to every Washington resident and not just people, of the right age.
And is there also, I mean, when Medicare Advantage, doesn't that also have the intervention of insurance companies involved? So it is not, which would be different from Washington Health Trust. There would be no insurance companies involved.
That's correct.
Okay. Let's see. Other Medicare Advantage is not Medicare. Thank you. Yes,
True.
true. But I mean, I feel like they're trying to align themselves in in many ways to sort of to get people. Yeah, you're right. You're right, Patrick. It's not Medicare at all. They
Well,
just
and I would add too that many of the reasons that people choose Medicare Advantage is that it can be a better option for people who are healthy because it covers some things that Medicare doesn't cover. But those are also things that would be covered by the Washington Health Trust. So,
Chris, did you
okay.
have a question? Yeah.
I do. Well, two things. And I'm sure everybody knows this. Medicare Advantage is not Medicare, but it's predicated on, as you know, people on Medicare and having to make that choice one way or the other to get that. The biggest leverage that they have is when it comes to medications, which basic Medicare does not cover wholly as Med Advantage would, a Med Advantage program would. Anyway, aside from that, my question is, how will this trust maintain either its viability if there are cost escalations and just inflation in healthcare because we just love expensive healthcare in this country? How does the trust remain viable?
good question. I mean, there's definitely a lot of these fine tuning to figure out yet. My question was, what if everybody moves to Washington State?
Yeah.
What are we going to do?
The secret's out. Washington will help you.
So I think, it'll be because it's, in the future, the vision I can see in the future where all or almost all of Washingtonians are covered by the Washington Health Trust, then we are all of us invested in making sure that all of the rules and regulations are meeting the needs of the people. And so the Washington Health Trust Board will hear from us if something isn't working. And if we have to change the way that the financing works, then that's something we do on an ongoing basis, like we do with any other budgetary need.
So Angie is asking, how would this system work with HSAs? And do you mean, Angie, an HSA like an HCA, like those health
Savings accounts, I think.
savings, that HSA, health savings accounts, I'm assuming? How would, does Whole Washington refer to this somewhere on their website, or is the HSA program a competitor in some ways?
Go ahead, Bree.
I was just doing a search on the Whole Washington website because that is not a question I know the answer to.
Yeah, my understanding of HSAs is that you can pay into them so that you can basically cover things that insurance doesn't cover. In this case, insurance covers basically everything. And so There might be a scenario in which, I mean, you can still have your HSA in this system. It's not going to obliterate that, but maybe I'm misunderstanding how HSAs work. I've never used them before
Can I,
myself, but
may I?
yes,
Go ahead.
please.
I'm sorry, Chris. So HSA, and I forget the competitor to it, there's two models there. And they really serve to sort of augment costs. So one type, and I believe it is HSA, will allow you to do things like purchase aspirin or Tylenol and get reimbursed for it, or other prescriptions as well, and or pay co-payments or your share of cost. And then typically, if you don't spend the money, if it's employer based, if you don't spend the money by the end of the year, it's a giveaway. So employees are really encouraged to spend down their HSA. If I recall, that's
I think it's the
one.
FSA you're thinking of.
FSA, yeah. So there's HSAs and FSAs. Thank you. So HSAs, you say I'm going to put in, let's say, 300 in employee matches. That one has a degree of rollover where the FSA you have to spend down before that year ends. That would be independent of the insurance coverage if an employer offers that.
Right. And so like I currently have an HSA plan, because it ends up being the most affordable, quote unquote affordable. Um, and it's really it's a way that you can use some tax advantages that if you don't spend all of the money in your HSA, you're not essentially you get a tax credit for it. So it works out well for wealthy, healthy people.
I have one more question here because we're almost at 7 o'clock. Oh, here's Jenny. If you want to read in the chat, Jenny
Oh,
has
nice.
some information about FSA, flexible spending account. But there is another question here. Dave is asking, Pete Buttigieg proposed what he called Medicare for all who want it, meaning individuals could stick with their private insurance if they chose to. Do you imagine or think that that the WHT is a state version of Medicare for all who want it?
I think it's similar. I think the hope is that it will be so much better that almost everyone would transition to it, because obviously the more people you have in it, the more robust it is and the better it will work.
Yeah. So please refer to the chat, everyone, for Jenny's information here about FSAs. It's pretty good information that can just at least let you know what it is, and you can feel free to check out the whole Washington website, which Pari had put the website into the chat so that you can just learn some more about it. I feel like with the cuts that are coming and what this year is going to potentially bring to folks who need health care, I am imagining that a lot of people might be looking at this whole concept with fresh eyes. That the idea of universal health care just doesn't sound so fringe or outrageous anymore. It just is going to be life saving to so many people who will not be covered under all these new cuts. So, Taylor and Pari, thank you so much for being here tonight and giving us such great information. Everyone, if you know somebody who wanted to be at the meeting tonight who did not get to be here, we've got this exact deck of slides that we're going to put on our program's hub page. Contact information for Pari and for Taylor, that you can contact them if you would like. So spread the word, talk to folks. If anyone missed the meeting tonight, who you know, friends or members, just let them know to keep their ears perked up about this, and let's keep talking about it. And if you have any questions, you can let me know or contact Pari and Taylor directly. So
Yeah,
thanks again.
Thank you so
Thank
much for having
you.
us.
Thank
Thank you
you.
for all the questions.
Yeah.
And I just want to ask, I think, Rachel, you had some ideas for getting other LDs in on the fight.
I mean, I certainly can help to, and
That'd
Jordan
be
as
great.
well can connect you with the chairs of the other LDs.
Okay.
And they might also have members in their LD who are working on this very thing. So, yeah,
Great.
I'd be happy to talk with you offline about that.
Sounds great. And thank
Thank
you. I see some folks, Jenny, saying you've hadn't heard about it before and have already signed the pledge and commented on the bills. So yeah, keep spreading the word. I only heard about this 8 months ago, so it's new for me too.
Great. Thank you again. Thanks so
Thank
much.
you.
Jordan, I will hand off the floor to you.